Health Guru here. Let's talk about the problem with doctors. Most of us have a positive overall view of medical doctors, and roughly half or more believe they can routinely count on medical doctors to do a good job, to show concern for patients' interests, and to provide fair and accurate information. However, about half of us see professional misconduct as at least a moderately big problem, and many are skeptical that doctors are transparent about conflicts of interest or take responsibility for mistakes. Studies show that adults age 50 and older are more likely than those under the age of 50 to trust medical doctors. A majority of these 50-year-older patients say doctors do a good job providing diagnosis and treatment recommendations all or most of the time. The older adults are more likely than younger adults to believe medical doctors care about their patients. Blacks and Hispanics are more likely than whites to see professional misconduct among medical doctors. The one system we trust to bill our caretakers is also giving them the short end of the stick in social aspect of their work. Physicians take a slew of scientific courses to prepare them, but few get valuable social education. Clinical experience doesn't begin until the third year, whipping through short rotations and involving a hidden curriculum in which students learn to communicate with patients by watching their superiors. What results is a breadth of experience but no depth in bedside manner. To err is human. Every misstep is an opportunity to learn and improve. But when the mistakes are made by doctors, lives can be compromised or even lost. Among malpractice claims, about 30% are due to diagnostic errors. The most common medical errors are misdiagnosis. Error in diagnosis is a common medical error. Delayed diagnosis. A delayed diagnosis can be as detrimental as a misdiagnosis. Medication error. One of the most common mistakes that occurs in the course of medical treatment. Infection. And bad medical devices. When a doctor makes an unavoidable mistake that another doctor would have made in the same circumstances, it's just a mistake. However, if they made a mistake as a result of negligence, it's called medical malpractice. Studies have shown that doctors seriously misdiagnose fatal illnesses about 20% of the time. So millions of patients are being treated for the wrong disease. As shockingly as that is, the most astonishing fact may be that the rate has not really changed since the 1930s. It has been reported that most people will receive an incorrect or late diagnosis at least once in their lives, sometimes with serious consequences. It's been cited that 12 million people, about 5% of adults who seek outpatient care, are misdiagnosed annually. Approximately 251,000 lives are claimed each year because of medical error. This number is higher than deaths caused by stroke, accidents, or Alzheimer's. Many doctors have tunnel vision when treating patients. They see the most prominent problem and address it, often losing grasp of a holistic view of the patient and neglecting his humanity in their attempt to treat him. In short, they see the medical problem as opposed to the entire person. This doesn't mean that doctors are heartless. The number one reason doctors choose the profession is to help people, and the grueling work it takes to become an MD is clear evidence of their devotion to their career. Doctors are clearly more concerned with getting the job done than having a personal touch with patients. This might be beneficial. The more people they can cure, the better, right? Not true. A study conducted shows that compassionate, attentive care results in better therapeutic impact for patients and lowered depression rates with elevated career meaning for physicians. It creates a better reputation for a healthcare facility at no greater use of economic resources. Educating our physicians to be socially competent may seem difficult to add to their quest for knowledge. However, some schools are already doing it. Schools increase their diversity to give their students a wider perspective and more capacity for empathy. It is proven that we can teach people how to express compassion in a clinical setting, which alone could drastically improve the way we provide care. We should be implementing these strategies everywhere, as opposed to hoping doctors inadvertently learn communication through fleeting clinical experiences. In a world where quantity supersedes quality, we need to take back the reins and create Renaissance men and women of medicine, where the demands of education don't erode the ethics of students and destroy their idealism for their careers. The welfare of patients, doctors, and the entire health system depends on it. So now that we know better, let's do better. Okay, now time for movement. Let's see if we can get some of these doctors together and do some movement. Okay, everybody, you ready? Just follow me. Come on now. Let's go. Yeah. All right. Yeah. Yeah. All right. Yeah. Yeah. So, how'd you do? Great. See you next time.